You may begin your test.
BSI scene safety.
Your scene is safe. You have a 35-year-old male, unresponsive, with a gunshot wound to the right chest, an arterial bleeding gunshot wound to the left forearm, and a knife stuck in their abdomen. Please control the bleeding.
I'm going to address the arterial bleed in the left forearm first by applying direct pressure with my gloved hand.
Direct pressure does not control the bleeding.
I'm going to go ahead and use my quick clot hemostatic dressing. Does that control the bleeding?
That does not control the bleeding.
Okay, I'm going to go ahead and use my tourniquet. Applying my tourniquet high and tight above the elbow, at least 2 inches above the injury, proximal to the heart. Once it's tight, I'm going to go ahead and twist the windlass until my tourniquet is completely tight and bleeding has been controlled or I've lost pulse in the extremity. I'm going to secure it into place. I'm going to go ahead and write the time that I applied the tourniquet on.
Bleeding is now controlled.
Okay, I'm going to go take my gloved hand. I'm going to place it over the sucking chest wound in the chest.
That does not control the bleeding.
Okay, I'm going to go ahead and wipe away the blood, grab my Asherman's chest seal. I'm going to go ahead and apply my chest seal to the gunshot wound over the chest.
The bleeding is controlled.
Okay, I'm going to dress a knife in the belly. I'm going to stabilize this object in place by measuring the handle using my fingers. I'm going to make sure I don't move the object or disturb it. I'm going to grab my rolled gauze and create the donut around my fingers. Once I've created my donut, I'm going to go ahead and remove it from my fingers, fold it in half. I'm going to apply it over the device, making sure I try not to move it as much as possible. And then I'm going to secure it by taping it down on 4 sides.
Impaled object is secured.